Rhythm. She is A&O times 4, can answer all their questions. Just complete left side deficit.
Compared to other healthcare professions, pre-hospital emergency medical services is relatively young. Developing in the late 1960s and early 70s as rescue squads who took the place of funeral homes, simply transporting the sick and injured to the hospital.
You know, EMS is really built on the foundation of volunteers and rescue squad members, again, volunteers who would leave their jobs during the day and just trying to help neighbors to what is now a profession.
Your arm just like that for me.
The tremendous growth of the population of North Carolina has been one of the driving forces in the transition from primarily volunteer-based agencies to many full-time paid systems.
You know, EMS used to be done because it was the right thing to do, and now I feel like that EMS has truly become a healthcare profession.
Fortunately for us, there's still a lot of those rescue squads around, and they're still the backbone of the volunteer side. But just the sheer requirements of education, it makes it almost impossible to be a volunteer in emergency medical services any longer.
You start getting into your epi drips, that's when you're doing 1 mic per ml. Right.
The educational requirements for pre-hospital providers has increased from an 80-hour first aid course to nearly 300 hours for EMTs and 1,200 hours for paramedics.
We're truly practitioners now, and we've moved well past the old descriptions of being the people who, do you carry oxygen? That was the most common question we got. And do you drive the ambulance? Well, yeah, we do both of those, but we do more things. But truly, we've moved past that now.
Okay, you having any chest pain? Okay, what about any shortness of breath?
A little bit.
EMS professionals' skill set and scope of practice have expanded significantly.
It's going to read the amount of carbon dioxide you'll be breathing out.
12-lead ECG monitoring and cardiac care, advanced airway procedures, trauma management, and an extensive medication formulary.
I think we're moving from just a technician mindset to more of the EMS clinician as a provider who's really more rounded out, and not just in their skills, but in their knowledge of medicine. And so they're not just technicians anymore. They are really a bridge between the entire public health and health infrastructure and the communities.
When you think about what you started in its infancy to what you're able to do now, you know, for treat and release and, you know, termination of efforts in the field, because there's nothing different that's going to happen at the hospital, has been huge advancements.
EMS 11, difficulty breathing.
You call 911, you get a specialized crew that is capable of handling whatever emergency I have and has the equipment to do it in a manner that it's no different than if I'm laying in the hospital bed in the emergency department. It's basically an emergency department on wheels.
Heart rate's currently 62, EKG unremarkable.
And I think the reason EMS has been very successful in growing as fast as it has over, say, 50 or 60 years is that EMS fills a gap. And there's no one else that you're going to call. You know, you call 911 and we show up in usually 10 minutes or less, you know, and we're able to essentially take the emergency room to the patient side. There is no other profession or service that delivers the things that we do in EMS.
EMS professionals today do more than just respond to 911 calls.
So what I'm going to do right now is we'll go ahead and get all the vital signs and all that out of the way.
Services such as community paramedics and mobile integrated health care allow providers to deliver medical care, chronic disease management, preventative services,
operating room cultures pending,
and telemedicine to patients in their homes in an effort to reduce the need for hospitalizations.
And that's allowed them to really step into that role as a guardian of health for the entire community.